Good day, family. Ron Holland here, host of Community Voices on Old School 105.3 and Praise 100.9. Today's program is brought to you by JT's Kia of Rock Hill, 840 North Anderson Road. Open enrollment for the Affordable Care Act began on November 1st and closes on December 15th. Efforts are underway to provide access to thousands of people in the Charlotte area. Here to discuss the Affordable Care Act enrollment is Anna Henderson of the Charlotte Center for Legal Advocacy. I knew I was going to get it right. Anna, thank you so much for coming in today.
Thank you for having me.
Absolutely. Open enrollment started on November 1st. December 15th is the absolute last day. Tell our viewers about open enrollment and what they should do to prepare for it.
So open enrollment began November 1st and will end December 15th, as he said. It's very important to get out there as soon as possible. This open enrollment is significantly shorter than it has been in previous years. So we're really encouraging people to be proactive because the steps to get enrolled can be a multi-step process. You can call and provide your information and schedule an appointment with a health insurance marketplace navigator. That number is 855-733-3711. And you can schedule an appointment, and it can be free, local, in-person appointment. You can also go on healthcare.gov and sign up yourself.
Now, what are your target numbers?
Our target numbers for enrollment?
Yes.
Well, we know right now over 7,000 people a day are enrolling in North Carolina.
7,000?
About 7,700 people.
Wow, wow. And that speaks to a huge need for health care.
Absolutely. We're seeing people come out in droves to get enrolled in affordable health insurance.
Now, are we on track to surpass previous year's numbers?
We do have higher rates of enrollment than past years.
Okay. Now, what are the routes for enrollment? Because folks are going to enroll online. Do they go in person? Tell our viewers about that process.
Yeah, so if you do schedule a free in-person appointment with a navigator, we can walk through that process with you. You can also go online on healthcare.gov and go through that process on your own, or you can call the marketplace. Okay.
Now, of course, you know that Republicans are intensely trying to repeal the Affordable Care Act, derisively known as Obamacare. Some might suggest that it might be a futile effort to enroll since it's going to be repealed. Talk about that.
That's a great point. And the number one question that we get is whether or not the ACA is law. And we can confidently answer that yes, it is. And if you are concerned about your access to affordable health care for 2018, we're telling people that the best thing you can do is call your senators and your congresspeople and voice those concerns, and also to get enrolled and to tell your friends and your neighbors to enroll in health insurance for 2018 because financial assistance is still available.
Yeah. Now, what happens when or if the Affordable Care Act is actually repealed, actually fully repealed? What's going to happen to all those who've signed up?
Yeah, so we really can't speculate on what will happen if it is repealed, but as of now, for 2018, the ACA is still the law. So we are encouraging people to get enrolled and get the best financial package that they can and look at all of their options.
Now, again, Republicans, since the onset, or actually since the implementation of Obamacare, they have been steadfast in their efforts to repeal the law. You know, thousands of people in Charlotte lack health care. Millions around the country lack health care. What is your overall assessment of our political environment where people will actually work to take health care away from people?
Well, that's a great question. I think that, again, if people are concerned about their access to affordable health care, the best way for them to voice that concern is by calling their congresspeople. But we have navigators all across North Carolina working to get people enrolled in health insurance.
Now, but you know that was a political answer right there. I want your personal assessment of individuals who, again, who get up in the morning and suggest that, folks don't, if you can't afford a health care, then ultimately that's your problem. At the end of the day, that's the result of taking health care away from people. So what do you feel personally, having been in this business for quite a while now? How do you feel personally about it?
I mean, health insurance to a lot of people is an absolute necessity. Especially affordable health insurance. So my personal opinion is for people to get out and get enrolled. Because, like I said, there is financial assistance available available to people. If you make between 100 and 400% of the federal poverty line, then you can get a financial package through the marketplace. We have people regularly coming in and getting premiums between $50 and $75 a month, which is a small price to pay to sleep at night knowing that you're not one accident away from bankruptcy.
Absolutely, absolutely. What are some of the biggest selling points of the Affordable Care Act?
So I think that the biggest selling point is the essential health benefits. So all plans cover essential health benefits like maternity care and hospital services, prescription drug services. And so you can rest assured that if you enroll, then you're receiving those benefits. Yeah.
Now, 2010, I remember, folks were, literally gallivanting around the country, particularly Democrats. We're talking about pre-existing conditions and children being able to stay on their parents' insurance for at least until they're 26. These are some huge benefits that seems to be not a strong enough argument for Republicans with regard to the ACA. So how should folks look at, navigating those arguments?
Absolutely. So I would say that those benefits that you're mentioning, that you can stay on your parents' health insurance, that you can't be denied for pre-existing conditions, are again things that people should voice as things they really value in the ACA. To make sure that those provisions aren't taken out.
Absolutely. Where should people go for additional information about enrollment requirements?
So you can go to healthcare.gov, and also if you have any questions about enrollment or you want to schedule an appointment with a health insurance navigator, you can call that number, which is 855-733-3711.
And one more time, that number?
855-733-3711.
Absolutely. Well, Anna, thank you so much for coming in to share information about the open enrollment.
Thank you for having me.
Absolutely. For more information about how to enroll in the Affordable Care Act and where to go, log on to our website, praisecharlotte.com and oldschool1053.com. Thank you so much for tuning in this week. I'm your host, Ron Holland. We'll talk with you next week.